Well, UP experts welcome the return to tighter rules in Metro Manila and nearby areas. Researchers say this move may help reduce the number of COVID-19 infections by more than 50,000. Let's find out more about this from the experts themselves, Professors Ranjit and Guido David of the UP OCTA Research team joining us on The Final Word. Professors, thank you so much for joining us on the program. We just heard from Tricia there, 220,000 if we remained in GCQ. What makes you believe that over the next 2 weeks in MECQ, Professor Rai, that we could bring this down by maybe 50,000?
Well, we did projections. Professor David and I are going to submit this in a formal paper. And that we will, of course, provide the media and, government. Based on our early projections, the move towards MECQ could save us 50,000 less cases. And so the actual projection for MECQ will be something like 150 to 170,000 cases by the end of August. So this is the situation we are in. A lot of people look at the numbers, and it's important to look at those final numbers. But what's important for us is to look at the trend. Because of MECQ, in the next 15 days, we are certain that the trend will go down. And that will, in a sense, be a very positive development as far as the NCR is concerned. Context is important here, Rico. We're imposing an MECQ largely to deal with the surge in the NCR and Calabarzon.
Yes.
We also, of course, include Bulacan, and this is the key, battleground as far as we're concerned. This is the key reason why we decided to do a MECQ. So apart from that, we also want to save the healthcare system from being overwhelmed.
So, Professor David, let me ask you, what is the current reproduction number if we break it down, or the number of people per infected person that the virus could pass to?
Yeah, currently the reproduction number in the Philippines is about 1.4. It went down. It was about as high as 1.75 to 1.8 just a few weeks ago. In NCR, it's also around 1.5. It went down, but it's actually starting to increase again, and that's because we're seeing huge numbers, which is what people are seeing. We're getting 4,000 to 5,000 cases per day.
So, Professor, would it be better to extend this MECQ all the way until the end of August to bring that reproduction number down below 1?
Yes, it's very possible because we were able to do that in Cebu. We were able to reduce the R0 to less than 1 in Cebu in 30 days. And we think we can do that also in NCR and in Calabarzon. I mean, right now, Cebu and the R0 in Cebu is less than 1. It's about 0.8. And it's stabilizing, but still going down a little bit. And just flattening the curve is just the first step. We want to remind people that when we flatten the curve, we haven't eliminated all the cases yet. So the ultimate goal is to lower the number of new cases down to a very manageable level. Right now, we're getting 1,000 plus new cases. I think 1,600.
So what would be a manageable level, Professor?
A very manageable level. Actually, it's a very low number for NCR. That would be about 70 cases per day. So it's about it's about 14 cases per day. So it's about 1 per million per day of population.
That will really need a lot of tight restrictions to be able to bring it down to that number. But Professor Rai, the business sector is complaining, and they're saying we can only afford 2 weeks of the modified enhanced community quarantine. What if we go all the way until the end of August? They say that we will suffer, and this economy could really hit a bottom.
It's really a tough situation we're in. We've let the virus, go out of control for a month. And this is now the situation where we find ourselves in. We need to work hard in the next 2 weeks to get the most out of this MECQ situation or status. And that will require not just the imposition of this health quarantine, but the scaling up of test, trace, isolate, and treat strategies by the national and local governments. Without that, the MECQ is meaningless.
Yes.
And from what we realized in Cebu, and of course the early part of the ECQ in Luzon 2 or 3 months ago, was that these quarantines are effective if the community, the private sector, and government work together. So those are the things we learned from Cebu.
Right.
It's also important that you protect your healthcare workers. So in Cebu, they were the heroes in fighting that, in reversing that surge in Cebu. And government, local and national government came at the right time to provide support for the doctors in Cebu. And it was very good of the president and the government to make a
Yes.
decision this time to save our
All right.
healthcare workers.
So, Professor David, briefly before we let both of you go, this could be a vicious cycle. I mean, we may see the numbers coming down during MECQ, but if the private and the public sector don't work together and the people do not follow these minimum safety protocols, it could be, we could go back again to GCQ, then back to MECQ, and maybe even revert back to ECQ.
Yes, I agree. It could be a vicious cycle, and that is very sad to know, especially for the people. Right now, we're not seeing a reprieve in the near future. I mean, because even when we flatten the curve, we still have to reduce the number of new cases down to a manageable level. I mean, maybe not even as low as 14, but even like 100 new cases per day is still somewhat manageable. But yes, that's why we have to sustain our efforts, and we have to work hard collectively. The media's helping, the government's helping, the local government, the businesses, and the individuals. We have to come together and work at this because we can't afford this vicious cycle. I mean, the economy is collapsing, but at the same time, we can't also fully recover as long as the virus is here because people are not going out. They're not going out to eat. I mean, restaurants may be open, but how many people are dining in? So as long as the virus is here, our economy is suffering. And that's why we have to solve this problem. If we can solve it as quickly as possible, the better.
Professor Guido David and Professor Ranjit Rai from the UP OCTA Research team, thank you for joining us
Thank you.
on The Final Word.